Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, a family nurse practitioner, a health and wellness blogger, and a community volunteer. And here we discuss evidence based health information regarding mind, body, and soul with a holistic emphasis. Thanks for joining me on this journey of health and wellness. Please enjoy the show. Hello, ATH Alice. Welcome to our 10th season of Abby Tyler's Healthy Living. Been doing this for 10 years now. I did it about 8 years on the smaller forum, and I've been doing this for the past 2 to 3 years with focus on Liberia also, and I'm also on YouTube. So welcome to our 10th season. We actually celebrated our 10th season on August 14th, but it was all the craziness with summer, and I totally forgot about that. So I did talk about it for a brief period in another video. But welcome to all of you. I'm only doing this because of you. 10 years been doing this. Would it be possible if I didn't have my faithful viewers, participants, and also those who joined along the way, those who left and all that too. But I really I'm grateful to all of you who have stayed all through the 10 years, and also those who have come and joined the group later on. Alrighty, so please share the show. Please share the show. Please invite others. So this is our 10th season, our first show of the 10th season. I'm just going to do a little recap, and then we're going to start our new season new show starting next Tuesday. Now there'll be times where Tuesday I won't be available, and I can do a brief broadcast of a show that a lot of people wanted to see. Okay, so again, first let me introduce myself again. My name is Abby Tyler. I'm a family nurse practitioner. I was a registered nurse for about 22 years. I did long-term care, and then I did 20 years as acute care nurse, telemetry nurse, cardiac nurse. Okay. And then I went back to school, and I got my master's, and I work as a family nurse practitioner. I did primary care, meaning I worked in the office, I saw patients there, and now I work in the facility. So I work as a clinical nurse practitioner where I'm seeing things like firsthand and all that. It's very, very taxing because it's a big facility and all, but it's welcoming. I love the people that I work with. And like I said, some days challenging, but I like it. Alrighty. And also be doing some topics sometimes people ask me to do some topics. So if you want me to do any topics and all that, something that's interesting to you, if it falls under my scope of practice, meaning I can take care of patients from birth to end of life and all that too. There's certain things that's specialty, meaning that's outside my scope of practice, primary care that I take care of, but I still have to refer them to a specialist and all that too. So if it falls within my scope of practice, I can talk about it, and also I can tell you when to go to a specialist. Okay. Okay, so as always, my disclaimer, I am a provider. Provider meaning like I'm a nurse practitioner, doctor, PA, well, providers. Alrighty, but I'm not your provider. So please do not make any changes to your regimen without checking with your own provider first, okay? So since it's our 10th anniversary, just gonna go over certain things. Alrighty, so know your numbers. Like I always say, know your numbers. I'll be answering questions, in between there. Okay. It's not going to be a long show. Alrighty. Happy September. Happy birthday to everybody celebrating their birthday in September. Okay. So know your numbers. Like I always tell people, right? That requires you go into your primary care physician or a provider and all that. So you do your annual visits, or sometimes you have to go annually. Sometimes you have to go in between. Some people have to do follow-up checkup and all that. So you want to know what your blood pressure is, okay? Your blood pressure, healthy blood pressure for you, because it could be something that with healthy blood pressure is like 120/70. But usually if you're on blood pressure medications, your doctor would be doing your blood pressure and all that periodically when you go to your family, to your appointment, or they'll tell you to check your blood pressure at a certain time when you're home. And when they look at it, they change your medications around. Based on that, they can see your blood pressure is controlled, meaning that it's not much higher than what it's supposed to be. And maybe that's where your normal is. Also, very low blood pressure too. You can be very dizzy. And yes, it can be very dangerous too. So if they're putting you on any kind of blood pressure medicine and they tell you to monitor your blood pressure at home, they will tell you what kind of machine to use. Most of the machines, you can buy them over on Amazon. It's much cheaper in Walmart, places like that. If you don't have those facilities in your area. You can always just go online and get it, or just go into regular CVS or Rite Aid. You can get it from there. Okay, and you tell you check your blood pressure. So if you're taking blood pressure medicine and you find yourself feeling dizzy, a little lightheaded, and all that, you want to tell your doctor about it, because that means your blood pressure probably is a little bit too low, and that's what's causing the problem. So very high blood pressure is not safe, very low blood pressure is not safe, so we want it controlled. Okay, know your numbers again, know your diabetic numbers. Ask your doctor when you go get your blood work done, your annual blood work. You're supposed to be getting your annual blood work anyways. Ask, I need to get my diabetic numbers down. What's your fasting blood pressure? Okay, if you're not diabetic yet, basically type 1 diabetes is when you get that when you're very young, and that stays on, and you can only be treated with insulin for the rest of your life. Type 2 diabetes is something you get later on in life, and you can start with pills, and then if it progresses, you need insulin after that. Okay, so know your numbers. Know what you when you wake up in the morning to get your blood sugar taken. What is that number? So when you do your blood work, okay, they'll tell you, okay, the number, your blood pressure, your blood sugar number is a little bit high when you wake up in the morning based on the blood work that we did. So let's do more testing. Most doctors are supposed to order your A1C anyways. That's the one to tell you what your blood sugar runs at over a 3-month period. And based on that, when it starts getting to like 6.5 or so, they'll be like, okay, you're kind of pre-diabetic. You get to 7, you're diabetic and all that. Okay, most of the time type 2 diabetes is basically because of what you're eating, your family in your history, also because it's also hereditary, so you can get that. Now that doesn't mean that if you're type 2 diabetes and you start that, you're never going to go back to not being diabetic, or your number is not going to go down to where your doctor might say, okay, it's important, we don't have to treat you with medication, we can treat you with your diet. Okay, so that's why I was telling people, if you're going to eat a lot of rice and pasta and all that, you want to cut down that, because that also increases the blood glucose in your body and all. Okay, exercising. You see my videos all the time. I do my walk. I stopped for about a week or so because it was the end of the summer and I was so busy with everything else and all that too. So, but I'm going back to my walk again. So walking at least 30 minutes a day, brisk walking. You can do the walking at work. You can do it in the mall. You can do it anywhere. That's like because people might say, okay, well, I do a lot of walking at work, so that should count for it. Not really, because your body gets used to like the kind of walking that you're gonna be doing. So you want to go above a little bit in that. Okay, so brisk walk. Make sure you check with your doctor first. Make sure you're healthy to walk that long. Okay, because some people have problems with asthma, COPD, and that may also affect that when you can't breathe healthily. Alrighty. So know your numbers, know your blood pressure, know your glucose number, know your kidney numbers. Again, ask your doctor, okay, you did my blood work and all. I just want to see what my kidney numbers are, my BUN and creatinine, meaning how your body clears out the toxins out of your body. I want to know my GFR. Okay, that's the important one that tells you what stage of kidney disease you're in. Again, I'm going to say it again. The kidneys don't hurt. Okay, so you could be like in kidney failure and you're getting down to like stage 1, stage 2, stage 1, stage 2. We don't really do that much with it unless if you also have diabetes and high blood pressure and everything with that too. Alrighty. So when you start getting to stage 3, of course, you'll be doing your blood work every time so they can monitor that. When you start getting towards stage 3, we start getting a little more concerned and we start trying to, manage that with some medications and lifestyle changes as well. It's always going to be and with lifestyle changes. Most of the time we start certain things with lifestyle changes and then you continue that. Even if we put you on medication, you still have to do lifestyle changes. There are some other diseases like lifestyle changes is not going to do you any good, like your thyroid and things like that. But you still want you to be healthy anyways, because the thyroid, the one that's here, it controls everything, your blood pressure, everything's in your body. So of course you want to do that. But that you have to take medication for if you're hyperthyroid, meaning high, or hypo, meaning low. Okay, so know your numbers. Again, know your blood pressure, know your diabetic numbers, know your kidney numbers. Check your liver also too, because there's some, especially the younger ones who do a lot of drinking too, and also even some medications can also affect the liver too. So when you're taking medication for your cholesterol, know your cholesterol also. Okay, your happy cholesterol, that's your HDL, and your dirty cholesterol, low down, loser, we call that LDL. Know that also, all right? So you're gonna say, okay, you do my blood work. Your doctor's gonna open up your chart, which is what I do when I'm discussing lab results with the patients and all. Look at that and see, this is what your numbers are. This is the range where it's supposed to be. So if it's okay, if it's supposed to be between 100, 180 to 200, and your number's higher than that. So you say, what's the range and what's my number? Your doctor may say, okay, let's go ahead and do some healthy eating, exercising, and then we'll check that again in 3 to 6 months. If the number remains that high and you have other issues too, we'll look at all the other risk factors that you have. Are you overweight? Do you have family history of that? Do you have any other issues? Again, like I said, high blood pressure, high cholesterol, diabetes, all those things will come into play when it comes time to treat you, because another patient might say, a friend, a family member might say, well, I have this and my doctor didn't say anything about treating me, or they treating me with this. Why are they treating me with that? And remember, individualize your care based on your medical history, based on your family history and all that. Okay. So know your numbers, know your kidney numbers, know your blood pressure, know your cholesterol number, eat healthy. Let me see where, again, physically try to walk at least 30 minutes a day or more. You can do some dancing and a lot of things on, especially now in my area. It's going to start getting cold soon. You won't be able to be walking outside. So at least you can, go to the gym or go to the mall. It's free. You can walk around. There's some huge malls in different areas. You can go there and walk around. Okay. And I think I go back in a couple of reels that I did. We have this walking thing. It's like a stepper I have at home. I can do that as well. Okay. And I did a couple of other machines, devices that you can do also to work your whole body and work your upper body as well. All right. I always say when you're eating, eat a lot of seafood, a lot of food from the sea and less from the land. Okay. So you're eating pig feed, you're eating, if you're gonna eat chicken, make sure you're boiling it or you're broiling it. Eat a lot of fish and all. I like fish, but I'm not crazy about the bones. I don't know. For some reason I can do the bones and all. Okay. So and yeah. Good if you can have some pepper soup, you can cut in between, because a lot of people eat a lot of soup that has like red oil and things like that. So cut back in the oily things. So a little bit of pepper soup in between there. Talking to our Liberian audience. Okay. So just do that. I'm not talking against anybody's food. I'm just saying there's certain things, especially as you start getting older. And that's when the disease process start coming into play. You want to try to help yourself along the way there. Okay. Women, making sure you're getting your yearly mammogram. All right. Especially if you have a family history of what is on your mother's side or your father's side, you want to be getting your mammogram. Make sure you're doing your monthly breast examination and all that. I did a whole show about that. You can go back and look in there. Men, talk to your doctor if you can get your prostate checked. Okay. Doesn't take that long, and you also do the blood work. All right. Also check your mental health. People talk about it. We live in a country where it's like so stressful. We live in this world, and especially now with the political season going on, and even before that, you're online and you see people arguing here and there, and like one thing you think that people would just think is funny or whatever, and sometimes it can be real insulting too, and you want to react to it because you're like, okay, I want to be the person that goes in there and says you shouldn't be doing stuff like that. But sometimes you just have to. Sometimes I find myself doing that too. I go in there and then I just like, nope, delete, because then they're going to be responding and you have to respond. And sometimes it's just not worth it. Yes, in that time, you want to speak up for a group, maybe for yourself, for a marginalized group. And sometimes, but it's like, is it worth it at that moment? Calm yourself down and do something else. And then maybe when you do respond, you can respond in a way where it's a little more concise and it's a little bit less argumentative. So you're not going back and forth with that person. And sometimes you just write your statement and just leave it like that and just put okay. If they say anything else, you said okay. You spoke your piece and you move on, because it's very important. We don't live in the community where some people still do, where your neighbors, you're sitting there talking outside and having fun and all. Most of us know each other through the internet and all. So watch yourself, protect your peace, protect your peace, protect your peace. Okay. And I did talk about the active lifestyle and all that. So again, like I said, this is our 10th anniversary. Let me just do this year. 10th anniversary. Let me go in here. Okay. So again, it's our 10th anniversary show. I've been doing this again for like 10 years. I started this mainly, again, I started this forum way back because when I used to be on those other different forums and you talk about healthcare and your posts would just drop to the very bottom. And also by having some Liberian patients and also just being around our people and all, a lot of things that are not relevant to us or in a way where it's like culturally relevant. It was very important that somebody start talking about that. Over the years, I've seen other people coming on and starting their forums or doing their health shows and all that too. Appreciate that because, trust me, the more of us out there, the more people can get to know about health information. Because also when you think about it, a lot of people, okay, I can just go online and just Google stuff. Sometimes they tell you, even when you're doing Google thing, they tell you this disclaimer, this is a general information and all that. You must speak to your provider so you can get it a little bit more. So yes, I love a patient that's educated on their health because I'll tell you, go ahead and look it up and all. But at the same time, make sure that it's tailored to you. So you're going to be doing that with your own provider. That's why I always say I'm a provider, but I'm not your provider. Okay. So I think I went over everything. Know your numbers, know your main numbers, get your screening. Also at age 40, I think age 40 now, you're supposed to be doing your colon screening, colon cancer screening. If you have that in your family, make sure you find out when that person was diagnosed, especially like a first degree relative, like your mother, father, a brother or sister, and they want you to start, you know, getting your screening done at least 5 to 10 years prior to when they were discharged. Okay, discharged when they were sorry, when they were diagnosed. Alrighty. I think I got everything there. And again, Facebook doesn't always send out the alerts. So I come on 7 o'clock, 7 o'clock PM Eastern time. Okay, so whatever time it is, 7 o'clock in the evening in New York is when I'll be on. Alrighty, and that's the live shows on Tuesdays, and then I do Abby's daily dose during the week. So it's like little short videos, 60 to 90-second videos during the day, but I put on like health information also. Alrighty. So if you're joining me from Abby Tyler's Healthy Living page, I say thank you. If you're joining me from Focus in Liberia, I say thank you. And if you're also joining me from YouTube, I say thank you as well. Okay. So let me just see any questions here, but let me go in here. Okay. Comments. Okay, Barry Abraham is like, is a thumb up high there. And who is this? Stevie. Hi, Abby Tyler. Hi, Stevie. Thanks for watching. Thanks for watching. So, so I hope you guys all had a nice summer. I know for those of you who are in Australia, I think you're going into your summer now. I think we have opposites and other places where, the seasons don't change at all. Lucky you. I'm glad I'm moving to summer where it's gonna be nice and warm all year round eventually as I get older. But thank you all. Thank you all so very much. Like again, like I said, you know your body, you're supposed to, talk to your doctor if you notice anything's changed that's going on that you're noticing. Okay, I've been having this pain here. How long has it been going on? Your doctor's gonna ask you certain things. I did a show on the kind of questions that we ask you, okay? Like, okay, I'm having this pain in my knee. How long have you been having the pain in your knee? When did it start? You don't necessarily have to know the exact date, but you can say, oh, you know what? I went on vacation in July, and when I came back, my knee was hurting and all that. So then right away we know because it's like, okay, it's been since July. So we're talking about a month. Has it been hurting to where you can't go to, is it waking you up, the pain? Is it waking you up at night? Have you tried anything that's going to help with the pain? Have you tried anything that make the, anything else that makes the pain worse? And all those other stuff. Do you have a numbness in your leg? All those things. So when you do go to your doctor's office and all for your appointment, it's also important. Write your questions down. Okay, write this information down. So the doctor's gonna be in the room for 5 to 10 minutes. So you want to have all those questions down, all that. And sometimes you have a scribe, somebody who asks you all those questions, or the medical assistant will ask you all those questions and all that. So when the doctor walks into the room or the provider walks into the room, you're ready to go. So you're sitting there. If you need somebody else to be listening when the doctor walks in, just say, okay, don't have them on hold forever. Let them come in. When the doctor comes in, you pick up the phone, you say, okay, I'm there. I'm gonna have my relative on the phone or my friend on the phone. They want to just listen up because I may forget something, or maybe sometimes again, like I said, somebody who doesn't speak English, or somebody who is elderly, or especially or like a young person who's going into the adult field to see an adult doctor to where they've seen a pediatrician before and now it's their first time going to see the adult doctor and all that. So it's important that you have all that information down. Okay. And again, like I said, if you guys have any questions that you need me to any topics that you want me to talk about, let me know because I usually have to put everything together and then I put it on. And if you're asking for a topic to talk about, okay, please make sure you're watching that day too. All right. So that way at least I can, I can answer all your questions at that time. I know it's not always possible for people to be there all the time. All right. So let me see there. I've been talking now for, I wanted to talk for about 10 minutes, but it's almost 20. But in the meantime, so again, thank you all. Thank you all so very much for getting to this where I know for most Liberian forums, it doesn't last that long because especially if it's not politics or gossip and all that too, nothing wrong with those forums. We need to be well balanced with health and gossip and entertainment and all that too. But I know how hard it is to like maintain a forum, especially talking about health because like again hypertension, high blood pressure, cholesterol, all of that, it's not sexy, it's not gossipy, it's not anything that's like, but it's an important part of our life. Health is wealth. Okay, so keep walking, keep exercising, keep eating healthy. I think, let me see here, who says Garmin Masali said you could start a segment called Ask Abby or something like that. I could do that. Sounds good. I was thinking about that, but then if I guess I have to let you guys know way ahead of time because I was like, I could do that, just sit there, and then it's like nobody asks any questions, and I'm just sitting there waiting. But yeah, inbox me, tell me what would be the best way for me to do that. If I can do it live or I can do it, like maybe during the week, like a short video during the week where somebody can ask me stuff and I can put it on, or just ask me a question, send me a question, and then I can make a video of it. I could do that too. All right. So whichever way will work, I'll look into that. Okay. And I'm also looking forward to collaborating with other media entities too, so my video can go to a wider audience as well. So I told them after summer, when everything died down, we'll cook out and the dancing and all, then we can start to that. Okay. So thank you all for watching. Now, for those of you who will be watching now, I say thank you. And I know I speak fast and I've been practicing to speak slow. And for those of you who are watching now, I say thank you. For those of you who will be watching later, I say thank you. Thank you all for your love and support. I really, really appreciate it. You don't know how some days where it's like, I don't want to do this. And I'm like, I don't want to do this. I really don't have the time. That's why you don't see too many people who are in providers who are on here, because we really don't have the time. Most of my time is like seeing patients, documenting, charting, and all that. So I'm charting late into the night and all. So it's very important that I do that. My glasses on, by the way. I hope you're getting your annually eye checked. Okay. So Garmin said thank you very much. And thanks for watching. Please and just inbox me and the ideas that you have. Okay. So thank you all for watching. Alrighty. And I will do again. If you haven't liked and follow Abby Tyler's Healthy Living page, look for this logo. It's purple because the other one I'm not accepting patients on there. Oh my God. Thinking of my patients. I'm not accepting members on there. Just so this is the active page, Abby Tyler's Healthy Living page. Click on that and join, because I do Abby's daily dose during the week too. So you don't want to miss those short videos. All right. It's like 90 seconds, 60 to 90 seconds, and helpful information. But in the meantime, you guys stay safe, stay healthy. Happy birthday again to everybody celebrating their birthday in the month of September. Stay safe. And I'll see you guys in Abby's Daily Dose. And then I'll start again next week with our new shows, Tuesday at 7 p.m. Eastern Time. Alrighty. Thank you. Good night.